Now, our next interview is the longest-serving Health Secretary, or he was when he handed over to Matt Hancock in 2018. That was around 16 months before COVID hit. And when Jeremy Hunt stepped down from frontbench politics, he said he wanted to do for patient safety what Al Gore did for climate change. In a new book, he's called for fundamental culture change in the NHS to prevent avoidable deaths. And with questions over Boris Johnson's future, he's never ruled out another run for the Conservative leadership either. Let's have a little listen to what happened when we spoke to Jeremy Hunt earlier this week. I started by asking about the NHS.
Well, I think it can be a rogue system from the point of view of families when something goes wrong, and sometimes they feel the shutters come down and no one wants to meet them and explain why a loved one's died. But I also think it's important to say that the vast majority of NHS care is absolutely brilliant. I've got 3 lovely children, all born on the NHS. It mended my elbow last year when I broke it, brilliant surgeon and physio. But the question is, when things do go wrong, as they do in all health systems, how good are we at learning from mistakes? And what I found writing this book is that the one thing the families want when something goes wrong is never money. It's just to feel that the loss of their loved one has some meaning because the system's learnt from what went wrong and isn't going to make the same mistake again.
And I guess that's the critical point, isn't it? Not making the same mistake again. Do you feel that the shutters coming down, as you say it, has effectively led to more avoidable deaths?
Yes, and when I was writing this book, I came to realise this is not just a problem in the NHS. It's a problem in healthcare systems all over the world. But if you think about the most traumatic thing that could happen in a hospital, which is perhaps a baby dying, that is equally traumatic for the doctors and nurses and midwives as it is for the family. And they have to come into work the next day and carry on looking after other patients. And they want to do nothing more than be open and transparent and learn the lessons. The system can make that impossible. They are worried, frankly, they'll get fired if they are open about having made a mistake, but then they're thinking about, what are their bosses in the NHS going to do, the regulators, what are they going to say, are they going to get struck off the register? And the result of that is that the one thing that matters more than anything else, which is that lessons are learned, is the thing that often doesn't happen because of this terrible blame culture.
You speak a little bit as if you weren't Health Secretary. You were the longest-serving Health Secretary. A lot of people would be thinking, why haven't you done something about it?
Well, I try to be honest in this book about where I did make progress and where I failed to make progress. I think in terms of transparency and openness, we are in a better place. 3 million more patients were using good or outstanding hospitals by the end of my time compared to when I started. But there were also things I didn't fix. I didn't put in place a long-term plan for the social care system. And when you hear stories, as we've been hearing this week, about people waiting an hour for an ambulance when they have a stroke, a lot of the reason for that is because hospitals can't discharge people into the social care system and they get full. And so there were things that I wish I had made more progress on.
Do you think Boris Johnson should be making more progress on social care as well? I remember it's one of the things that he obviously spoke about when he first became Prime Minister, and yet it doesn't feel like much has happened.
Yes, I think he has made some progress. The cap on care cost is being introduced, and that will be a big relief to people who have neurological conditions like dementia. But the core funding for local authorities is still not where it needs to be.
One of the stories that I found most shocking recently is the Shrewsbury and Telford Trust, which the report, of course, found that more than 200 babies and 9 mothers died unnecessarily because of failings in that trust, catastrophic failings in that trust. We also know, of course, that women who aren't white are 5 times more likely to die during pregnancy. Is the maternity care system in the UK fit for purpose?
The vast majority of births are totally safe, but we can do better. If we had the same maternity safety rates as Sweden, 1,000 more babies would live every year in England.
And why? What's going wrong? Is it funding for midwives? What is it? Is it attitudes?
Well, my select committee did a report into this last year, and Donna Ockenden did a report into Shrewsbury and Telford more recently, and we both said the same thing, which is, number one, we need more midwives and more doctors, at least 2,000 more midwives, at least 500 more doctors and nurses and other people. The government's accepted that recommendation. The second thing, though, is
Have you seen any progress on that, or have they just said that they accept it?
not yet. What we've heard is the government accepting the recommendation, but they haven't said when they will recruit those extra
And
midwives.
how long ago was it that you called for it then?
We called for it last summer.
And nothing's happened.
And we need to make progress urgently because we need every mum to know that if they are going into a maternity unit, there isn't going to be a shortage of midwives or doctors. So it is absolutely essential to act quickly.
Do you think that if men gave birth, the system would work better?
It's a good question. I think there are blind spots when it comes to women's illnesses.
Talking about women's health, there have been reports coming from the US that Roe versus Wade will be overturned. Now, you've personally said before that you think the abortion limit should be reduced to 12 weeks, although you have said that it's not a law that you would introduce if you would be Prime Minister. It's just a personal opinion of yours. What's your reaction to Roe versus Wade?
Well, I'm totally against it. Let me be clear. I'm a supporter of the system in Holland, which has no restrictions on early stage abortions, and then they get progressively higher as the pregnancy continues. So that's the system that but it's a personal view, and it's a matter of a free vote, and I always said in government positions this is not something for me to pursue. I'd be extremely worried if in the United States we ended up with a situation where women couldn't access basic health rights.
There's obviously been a huge pressure on the NHS recently through COVID, staff absences, treatments being delayed. If there is a spike in cases in the winter, are you worried about the preparedness of the NHS?
I'm always worried about the capacity of the NHS. If there was one thing that I wish I'd known at the start of my quite long time as Health Secretary, it is that you can't solve problems with money alone. Money matters, but there is a big and legitimate debate about funding for the NHS and care system. But you can't put £3 billion into the system and expect to see change unless there are £3 billion worth of extra doctors and nurses and beds to use.
For many families, things are really, really difficult. The government talks about the support that it's already put in, but do you feel that more needs to be done to help those, particularly on the lowest incomes?
I think the government is doing a lot. I mean, the sums of money in terms of billions of pounds, which of course come from taxpayers ultimately, are huge. But the core problem is that inflation is at record levels, and that is just eating away at family finances. And we heard the figures this week that the inflation rate is even higher for the poorest families. So I think the heart of the issue is how do we bring down the inflation rate? Personally, I'd be very attracted to things that reduce people's fuel bills, because that helps people on low incomes, but also brings down the inflation rate.
Some of your colleagues have talked about help on universal credit. Obviously, there was a £20 uplift during the pandemic. Is that the kind of thing you'd like to see targeted at the people on lower incomes?
I wouldn't like to second-guess the Chancellor on the precise measures, but I do think targeting help is the most important thing.
Do you like the idea of a windfall tax?
Let me say this, I'm pleased that the Chancellor has said all options are on the table, because I find it very difficult to justify BP buying back £2.5 billion of shares because of a hike in the oil price.
Do you think it's inevitable that the government's going to U-turn on this?
I think that we are hearing signs that all options are on the table, and so we need to watch this space.
It feels like it's something that you would be quite attracted to.
Personally, I find it very difficult to justify those extra profits.
The Met Police have concluded their investigation into Partygate, 126 fines for 8 gatherings. Should Boris Johnson have done the same as Keir Starmer and to have pledged to resign if he's found guilty of a criminal offence?
I wouldn't want to minimise the anger people feel about the fact that people in Downing Street did not follow the rules that they set for other people. But I think that the anger that the electorate feel, the way that my party suffered in the local elections, is about more than that. I think the fundamental problems in the economy, high inflation, low growth, are something that are worrying a lot of families. I don't think the next election will be about Partygate. I think it will be fought on which party has the best long-term plans for the economy, for the NHS, where I hope my book will make a contribution.
At the same time, I've spoken to Conservative MPs who said that Partygate came up an awful lot on the doorstep at those local elections? Because I guess it's about what people feel is the character of the Prime Minister as well.
I think there are some voters who were extremely angry, and there were some Conservative voters who were extremely angry. But I think those same voters also look at the situation in the world, look at what's happening in Ukraine, and see that what's going wrong there is of a scale with a totally different magnitude. I personally don't believe we should have a change in Prime Minister right now. Britain has been the most robust member of the Western Alliance. And I think the only person who would be pleased if we had a hiatus of several months in the leadership of the UK would be Vladimir Putin. That doesn't mean to say that I don't recognise the anger that a lot of people feel.
Do you think there's been a bit of a complacency after the local election results? Because they were pretty bad for your party, particularly in the south.
Let me put it this way. I think it would be wrong to say this is just midterm blues. I think the core reasons that people vote Conservative, which is the prospect of strong economic growth, the prospect of lower taxes, these things are not true at the moment, and people are really worried about the inflation level, the very low growth rates. I'm worried about it because I want us to be able to fund the NHS, spend more on defence, and offer the prospect of lower taxes. And the only way you can do all those things is by getting growth into the economy.
I'm not going to ask the typical if the ball came loose at the back of the scrum question, because frankly we actually do know the answer to it. You know, you haven't ruled out another crack at the leadership. You said earlier this year that your ambition hasn't completely vanished. Why do you think you would be good at the top job?
It's a very good way of asking the same question, Sophie. Full marks for trying. I've been very honest that I don't rule back a return to frontline politics. My ambition has ebbed somewhat since stepping back because I've loved being with my family. I know it's a terrible cliche when politicians say that, but it is actually true in my case.
It's not disappeared, is that?
It hasn't disappeared, but I don't think now is the moment for a change in Prime Minister. For the reason I mentioned, I think something that makes Vladimir Putin happy is precisely what we don't want at this moment, when we have the first European war in our lifetimes, the risk of chemical and biological and even nuclear weapons being used. The reports that you send back from places like Mariupol, I think, do give us a perspective, and Britain's role in the Western Alliance, contrary to what many people thought, has been extremely important, very robust, and it's what we need to see now.
OK, thank you very much.
Thank you.